Welcome to the Wellness Connection with Dr. McMinn. Dr. McMinn is Birmingham's wellness doctor, practicing cutting-edge, world-class wellness medicine at McMinn Clinic in Homewood, Alabama. Each week, Dr. McMinn interviews experts in the field of integrative wellness medicine. The Wellness Connection brings you the information you need to optimize your health in mind, body, and spirit. And now, here's Dr. McMinn.
And welcome back to the Wellness Connection with Dr. McMinn. We're here with Misty Walraven as usual, and we have a special guest, Dave Kalachik, who's talking about the Watermark Aries home sleep monitor device. So Dave, let's say there's somebody out there listening, they think that they or their spouse might have an issue like this. If they want to get tested, it's very simple. Just come to McMinn Clinic and we're happy to test them. They don't have to have any prior arrangement with us or connection with us. They don't have to be existing patients. Come on in and we'll get them set up with the device, and we'll be happy to get them tested. Now, let's say, Dave, if there's somebody out there in the audience listening to this who might be a physician or have some other situation, like let's say
nurse practitioner,
or they had a CPAP company, something like that, a home medical device company, and let's say they wanted to do some testing. How can they get in touch with you to learn more about the device?
So locally, Dr. McMinn, I reside in the Birmingham community. My number is area code 205-317-7882. Our website as well, simply www.watermarkmedical.com. Great resource. Patients can, or people who are more interested in the disease, can simply log in. Wealth of information. They can even do an online screener whereby they can immediately assess their own particular risk regarding sleep apnea and even indicate that they want follow-up to be tested.
That's fabulous. I know I had a fellow came in recently. His wife actually brought him in because he was so grumpy. And I suspected, of course, he had hypertension. He was a little bit thick in the neck, and I suspected this. And we got him tested. And sure enough, he had sleep apnea. And we got him on a CPAP. And wow, his wife came in and said he's just a new guy. And it's just a wonderful thing.
It's a complete game changer. And I think people don't even recognize over the course of 5, 10, 15 years what they're missing and how they felt when they actually did have a better night's sleep and a more restorative, deeper sleep.
So let me tell folks about the process. Let's say if somebody comes in, the first thing that the provider has to do, they have to suspect the problem and they have to order the test. It's very simple. You send the patient home with the monitor. They keep it overnight. They bring it back the next day. You connect it to your laptop or your computer, and they download the information. It goes off to Watermark. They analyze it. They send you a beautiful report the next day, in which you can then go over with your patient. And Dave can sort of teach you how to interpret the report. But it's just as simple as it can possibly be.
It works well, sir. It certainly provides a different mechanism. It's a very quick process. You can take a patient literally from just a suspicion that you have the patient wear the device that night. You can have them within or onto a meaningful therapy within 48, 72-hour window.
Oh, that's amazing.
So what if a patient, I have people ask me this, I'm just want to throw it out there, a patient takes the machine home and say something happens and they get maybe 2 hours worth of sleep that night. Is the proper procedure to keep it an additional night and kind of repeat the study so that you get an accurate representation of what's going on during the night?
Great question, Misty. So generally, the insurance companies have always used a benchmark, if you will, of 4 hours of data collection.
Okay.
So if that were the situation, the patient would simply keep that device, wear it an additional
And the computer will recognize that, and it kind of resets itself. There's nothing. I'm trying to explain that the procedure is really simple and that anyone can do it, and it kind of just resets itself to do the study over. It's not a big deal.
And the patient doesn't have to intervene. They don't do any of the programming. It's simply a
It's the computer that does everything, the on and off button. So it's very, very easy, and you're not looking at 3 or 4 weeks to get the results back. Cost effective. It seems to me like it's a no-brainer.
Dave, we talked about, let's say if somebody does have sleep apnea, then what are the therapies? Certainly CPAP is one, and it's a very effective one for a lot of folks for obstructive sleep apnea, but I do know some people who say, "Doctor, I just cannot wear a CPAP." And so are there any other options for them?
Absolutely, and Misty touched on it earlier. You hear the terms out there, mandibular repositioning device. Maybe more simply called an oral appliance.
Right.
And these are devices which would be custom made by a dentist that is working with sleep apnea. And the device will literally jut the lower jaw forward to keep that airway open. And some devices may even allow the tongue to remain in a receptacle, if you will, so that the tongue does not fall back. So an oral appliance is a great intervention if you have a patient that either can't or won't tolerate CPAP or AutoPAP, and works well for intervening where you have mild to moderate sleep apnea.
And there's some surgery, isn't there, that can be done?
Absolutely. As I'll call it kind of a last-ditch effort.
Right.
You've tried the oral appliance, you've failed at CPAP, that will not work for you. There may be an intervention where you have to go in and literally have an ENT perform surgery and open up that airway.
Right. And I'll give a shout out to our good friends Dr. Buddha and McCool. Dr. Buddha was on the show back a few weeks ago, and they do a wonderful job at this. And so if anybody gets to that point and they need the surgery,
last-ditch resort.
The last-ditch resort, once again, I'd highly recommend Dr. Buddha and McCool right there on Independence Drive there in Homewood. They would do a wonderful job.
So can it be used on children? I'm sorry, Dr.
Great question, Misty. Our formal clearance is to diagnose obstructive
Adults.
sleep apnea in people 18 and over.
Okay.
So although certainly sleep apnea is a consideration in children, then that might be something where you'd have surgical intervention to remove tonsils and really change their lives.
Okay.
Dave, are there any big medical institutions, like Cleveland Clinic or Mayo Clinic, anybody out there using this device that would be a reputable institution that we could turn to?
Dr. McMahon, we've got major private practices and hospitals, from VA medical centers to a lot of the hospital-based sleep labs that we've got up and running in each and every state today.
Oh, that's fabulous. And I guess let's talk about some bottom lines here, Dave. I think that, number one, I think sleep apnea is a huge problem. It's 95% of the time it goes undiagnosed.
Absolutely.
And I think it can have a profound impact on people's lives, including heart attacks and sudden death, right? As well as blood pressure, weight gain, grumpiness, depression, all kind of things. But I also want to make the point is good.
It's excellent.
If we recognize it and treat it, but you've got to recognize it first. So here, you and your folks at Watermark have come out with a fabulous device that cuts the cost of testing by 1/10 of what it was. That's easy to do in the comfort of your own home. And I want you to say, I'm not selling Watermark, but I do feel that it's just the way to go. It just seems like a no-brainer to me. Dave, I want to thank you for being on the show today. It's been delightful to talk to you about a very important subject. And we're going to sign up. Misty, make sure you put on Facebook all the information about Dave, and his numbers and email address, if anybody wants to get in touch with Dave. But if y'all want to get tested, you come on into McMinn Clinic and we'll get you tested with the Watermark device. And that'll do it for the Wellness Connection with Dr. McMinn. Thank you, Misty, for helping us out today. And we'll see y'all back next week on the Wellness Connection with Dr. McMinn.